Hello, my name's Ashlyn Adams. This is my head to toe assessment for MSN 610. This is my photo ID, and I'm going to scan the room now. Okay. First, I am going to enter the room, introduce myself. I'm Ashlyn Adams. I'm a nurse practitioner student. Is it okay if I do a head to toe exam on you today?
Yes, ma'am.
Okay, first, then I'm going to wash my hands. I'll put my hand sanitizer on. Okay, I'm going to obtain vital signs. Get her blood pressure. Also gonna put on the pulse ox. Okay, her blood pressure is 110/70 in the left arm, sitting down. Her oxygen level is 97% on room air, and her heart rate is 99. I am also going to see if her heart rate matches up to that. Okay, perfect, it does. And her respirations are 16 unlabored. I'm also going to take her temperature now. Underneath your tongue. (98.2), perfect. She is afebrile. I'm going to start by looking at her head. I'm going to palpate her skull for any tenderness. Any tenderness?
No.
Okay. I'm going to have you take your glasses off. I'm going to palpate the the maxillary and frontal sinus. Any tenderness?
No.
Okay. Her eyes are symmetric. Her ears are symmetric. Her skin has no lesions, masses, anything like that on it. Wendy, how old are you?
58.
She appears stated age. She has good posture. She looks well nourished. I'm just going to look at her skin and feel her skin. Her skin is warm to touch. I'm going to check her skin turgor. Skin turgor is within normal limits, shows good hydration. I'm going to go ahead and take a look at her eyes. So if you could remove your glasses for me. Okay, go ahead and look at that back wall. Red reflex noted. Red reflex is noted. I can visualize her optic cuff and optic disc. They are pearly white with clear borders, no papule edema noted, no drainage noted. I'm gonna go ahead now and look in her ears. Okay, I am going to pull up and back. Perfect. I am able to visualize her tympanic membrane. It is gray, pearly gray in color. I can visualize her canal. It is intact and cone of lights. There is no discharge at all. So now I am going to test the cranial nerves. So for cranial nerve 1, I'm going to have you plug one nostril, and I'm going to place this object. Close your eyes. Can you tell me what that smell is?
Vanilla.
Perfect, correct. And then switch. I'll place this in your hand. Can you tell me what you smell?
Strawberries.
Perfect. Cranial nerve 1 is intact. I'm going to go ahead and take a look in your nose. Okay, so the nares is patent. I do not indicate any deviated septum. I see no drainage. Now I'm going to go ahead and test cranial nerve number 2, and this is going to be visual acuity. Okay, Wendy, can you cover one eye? And this is with correction, and read the line that you can that is the furthest down.
C, F, D, N, J.
Perfect. Can you go ahead and cover the other eye? And read that line backwards.
J, H, D, F, C. That could be a PC.
Okay.
I
All
think
right.
it's an F.
So we have visual acuity of 20/30 bilaterally in both eyes. I'm going to go ahead and test the peripheral. I'm going to put my hands on either side, and you tell me when you can see me and which hand is moving.
Left.
Perfect.
Right.
Perfect. Okay, and now I'm going to test cranial nerve 3, 5, and 6. So I'm going to do the H test. Go ahead and follow, keep your body still, but move with your eyes and follow my pen light. Okay, the cardinal direction of gaze intact bilaterally, slight nystagmus noted in both eyes. Okay. 7-2. I'm going to have you take off your glasses. I am going to see if her pupils are reactive. Okay, we have Perla and DNC noted. I'm going to go ahead and test the 5th cranial nerve. Can you open your eyes wide? Squeeze them. Open. Can you clench your teeth? Close. Puff out your cheeks. And smile. Perfect. Cranial nerve 5 is intact. Now I'm going to test cranial nerve 7. I'm going to take a soft object and a sharp object, and you just tell me when you feel each. You can go ahead and take your glasses off.
I'm sorry. Soft. That's a sharp one. Soft. Sharp. Soft. Soft.
Perfect. Her mastoids, I'm going to. Okay. Cranial nerve 7 is intact. Now I'm going to test cranial nerve 8, which is your hearing. I'm going to start with the whisper test. I'm going to stand to the side of you and you tell me what I whisper. If you could block off your ear. The dog is tan.
The dog is tan.
Perfect. Switch side. The cat is black.
The cat is black.
Perfect. Okay. Next, I'm going to do the Renin test. I am going to activate this and put it back on your mastoid process. You tell me when you can't hear it anymore, and I will move it forward. Okay.
Now. Now.
Perfect. We're going to do that on the other side.
Yeah. Now.
Perfect. Okay, and then next we're going to do a test that's called the Weber test. I'm going to activate this and put it on your head, and you tell me when you can hear it. Perfect. Okay, so cranial nerve 8 is intact. Gross hearing is equal bilaterally. Okay. Now I'm going to test cranial nerve 9. I'm going to go behind you. I'm just going to palpate here. Go ahead and swallow for me. Okay, so the chronocassoid muscle, or cartilage, I think that's how you say it, sorry, I can't pronounce it right, and the thyroid was felt. With the thyroid, I did not feel any nodules or any enlargements there. All right, now I'm going to go ahead and take a look in your mouth. Okay. And I do not have a tongue depressor, but I am going to test gag reflex. Open your mouth. Okay. Stick your tongue out. And I would test gag reflex, but her oral hygiene is good. The teeth are seated well. The uvula rises midline. Gag reflex is intact. Her oral mucosa in the buccal space is moist and pink. And then go ahead and stick your tongue out. Move it side to side. The tongue protrudes. It does not show any deviation there. And yeah, okay. So that was for 9 and 10. For cranial nerve 11, I'm going to have you resist me. And resist me. Perfect. That is your trapezius and your sternocleidomastoid muscle. Okay, so then next I'm going to listen and feel your carotid artery. Sorry. Okay, I'm going to have you, I'm going to do this with the bell. Take a deep breath and hold. Okay, let it out. And take a deep breath and hold. And let it out. Perfect. I do not feel any bruise or thrills, venous hums. Next, I'm going to go ahead and palpate her lymph nodes. Okay, so in the back of the head is the occipital. Cannot feel them, no palpation. And the ear right here is your postauricular. Do not feel any, none are palpable. Preauricular. Your mandibular, submandibular, not palpable, submental, not palpable. Your anterior circle chain, non-palpable. Posterior circle chain, not palpable. Deep circle chain, not palpable. Have you kind of shrug your shoulders here. Supraclavicular, not palpable. Okay, all right. So did the lymph nodes, and then now I am going to go ahead and listen to your lungs. Auscultate your lungs. Take a deep breath for me. Blow it out. Yep, keep doing it in and out. Anteriorly, her lungs are equal bilaterally, clear throughout. When I push on you, say 99 each time.
99, 99, 99.
Tactile femoris intact bilaterally. And I'm going to go ahead and percuss. Any pain?
No.
Okay. I'll go ahead now and just listen to her heart. Okay, that was with the diaphragm. Now I'm going to do it with the bell. S1 and S2 heard clearly, S3 and S4 not heard. We have the apical, the pulmonic, tricuspid, and mitral. I listened with the diaphragm and the bell. So S1 and S3 were not heard. I did not hear any extra clicking, no murmurs, no rub, no friction, snaps, clicks, anything like that. I'm going to look for the PMI, point of maximal impulse now. So I'm going to go mid-clavicular in the 7th intercostal down here. Okay, so that is the point of maximal impulse. Now I am going to have my patient lay back.
Afraid I'm gonna fall off the end.
Okay, I'm gonna listen to her heart again, lying down. Okay, I'm gonna look at her abdomen, I'm gonna inspect it, and then I'm gonna listen and then palpate it. I'm going to listen to the abdominal arteries, the aorta, the renal arteries, the iliac arteries, and the femoral. I'm going to listen to bowel sounds first. Bowel sounds are heard in all 4 quadrants. Now I'm going to listen to the arteries. Aortic, renal, iliac, and femoral. No bruits or venous hums, anything like that noted. First, I'm going to do light palpation. Can you tell me if this hurts at all, okay? Any pain? Any pain? Okay. And then now I'm going to do deep palpation, and I'm also going to feel for the edges of the liver, spleen, and kidneys. Take a deep breath for me. Let it out. Any pain? Let it out. Breathe in. Let it out. Breathe in. Let it out. Okay, so I was able to palpate the edge of the liver in the right upper quadrant, the tip of the spleen in the left upper quadrant. I was not able to feel the kidneys in the lower right and left lower quadrant. Them are typically hard to palpate. Next, I'm going to then have my patient sit back up again. You can just stay like that.
Is it like this?
Yep.
Okay.
I'm going to inspect her back here. No lesions, masses noted, nothing like that. She has good posture. Tell me if you feel any pain.
No.
No pain noted. Go ahead and flex your head forward. Feel down. Her C7 ends right here, and then her T1 meets that. I'm gonna go ahead and listen to her lungs posteriorly. Go ahead and take a deep breath for me. Let it out. Deep breath. Let it out. Deep breath. Let it out. And deep breath. Let it out. Okay. So her lungs are equal and clear bilaterally, and that is anteriorly and posteriorly. I'm going to go ahead, and when I push on you, can you just say 99?
99. 99. 99.
Tactile femoris, intact and equal bilaterally. I'm going to listen to you, and each time I place my stethoscope, I need you to say the letter E.
E, 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 E.
No egophony, I think that's how you say it. Noted. I'm going to percuss. Any pain?
No.
Okay. All right, I'm gonna have you take a deep breath. Blow it out. Or thoracic, for her respirations is even. I don't see any curvature of the spine, any abnormalities. Okay, you can go ahead and face me, Wendy.
Okay.
Okay, I'm just going to look at her arms, look at the muscle mass. Her skin is even tone, no lesions or masses noted. Okay, okay, so we will do some range of motion here. So I'm gonna have you abduct, so you're gonna take your arms out, perfect. Adduct, perfect. Flex, perfect. Hyperextend behind your back, perfect. Okay, put them down. All right, so that was some active range of motion. Now we will do passive range of motion. Just let me do the work for you. Okay. Perfect. I'm gonna go ahead and make sure I check her pulses now too. So her radial pulse. Brachial pulse. Popliteal pulse. Dorsal pedius pulse, and posterior tibial pulse. They're all brisk but not bounding, equal bilaterally, so that is good. Now I'm going to do the great toe test. So you tell me, close your eyes. You tell me what direction I am going up.
Up, down.
Okay.
Up, down.
Okay, perfect. So the great toe, she has good direction in that. I'm going to do the Babinski test. So I'm going to go ahead and have you put your foot out for me. Okay, next one. Perfect. All right. Okay. So I'm going to do vibration test. I'm going to activate this, put it by your knee and put it by your leg, and just tell me when it quits. If I can. Okay. I'm going to do that on the other side. Perfect. Now we're going to do sensory, sharp and dull. I'm going to just touch various places of your body and you tell me if it's sharp or dull. Perfect. Okay. So now we will do some coordination skills. I need you to take your shin and bring it up all the way to your knee.
No, upwards.
Okay. Okay. I'm going to have you stand up. We're going to do the Romberg test. So I'm going to have you put your heels together. Can't do it.
I can't do it.
Okay. So Wendy has a positive Romberg test. She is unable to put her heels together with her eyes open and her eyes closed, which shows, you can have a seat now, ataxia, sensory ataxia. So she does have a positive Romberg test. I apologize, I'll have you stand up. I got one more test. This is the plantar drift. So I'm gonna have you close your eyes, put your arms up, just looking for swaying, anything like that, put them down. Okay, nope, she's good there. Go ahead and take a seat. I'm gonna go ahead and test deep tendon reflexes. Okay, so deep tendon reflexes, I'm going to do the brachial. Relax your arm. Just lay down a little bit. I'm going to do that on the other side. Sorry. Popliteal. So her deep tendon reflexes are +2, equal bilaterally, normal response. Okay. I am going to have you lay down. Just gonna do some more range of motion here. I'm gonna take the leg. This is passive, up, out, bend your knee. I'm going to do the other side. Perfect on the range of motion. I'm going to have you bring your knees up. I'm going to have you resist me. Okay, resist me. Okay, I'm gonna have you put your legs straight down, point your toes, pull them back, pull your toes back. Perfect. Go ahead and sit up. So passive and active range of motion is within normal limits. Okay, now we will do some cognitive things. Can you tell me your name?
Wendy Adams.
Your date of birth.
4764.
Okay, and who's the US president?
Joe Biden.
Okay, and now I'm gonna give you 3 words to remember. Okay, Garden Dog Blue. Can you say them?
Garden Dog Blue,
Perfect. What year is it?
2022.
Okay. Can you do serial sevens back from 100?
Probably not.
Let's try.
Okay. 100,
Okay,
93,
perfect.
86,
Okay,
79.
good job. Can you remember them 3 words that I told you?
They were garden, dog, and blue.
Good job. So Wendy is alert and oriented. She is not in any distress. She has good posture. She appears stated age. Let's see. I'm just sorry. I'm sitting here thinking. Yeah. I think that is everything. So I do, I appreciate you letting, one recommendation that I do have. So with your positive Romberg test, I do suggest that you would follow up with a neurologist and also maybe start to do some exercises and things that can focus on your balance, such as yoga, but really following up with that neurologist would be very beneficial to you because you have a positive Romberg test. But overall, you appear healthy and have been taking good care of your hygiene. I think that's everything. Okay, so thank you, and I am going to be sure to wash my hands again.
Thank you.
Thank you.